Hi, I'm Ari,
And I'm Mia.
and today we're going to be discussing if age and gender affects the likelihood of developing long COVID.
What is long COVID, you might ask? Long COVID is anyone who's experiencing post-COVID conditions, and this can include having any type of symptoms that last up to or longer than 4 weeks.
There are different risk factors that associates with the development and persistence of long COVID, one being age of how old the patient is, gender if they're male or female, severity, how severe the patient's initial COVID illness was, vaccines, was the patient vaccinated at the time of infection, and antiviral meds. Did the patient take any antiviral medication to treat that initial COVID? There are multiple risk factors that can affect the chances of contracting long COVID. However, it is strongly impacted by age, gender, and the severity of your initial COVID case. Figure 10 shows the trend that patients from the ages 50 and above experience equal severity in their symptoms. However, in graph B, we could see that after the age of 50, there was a major decrease in the percentage of patients experiencing these cognitive issues. You could see this in the lighter green colors. On the graph to the right, both males and females in the same age group have an equal chance at developing long COVID. But as age increases, we can see a drastic change in the likelihood for males. In figure 4, the different risk factors explain that long COVID and the severity of your initial COVID wave have almost a direct relationship, meaning that depending on how severe your symptoms were to begin with, it could potentially affect the severity of long COVID symptoms as well. On the graph, we could see that severity 3 has a larger coefficient between 100 and 200, showing that if your COVID initial symptoms were as severe, your likelihood of getting long COVID is twice as higher than when you have lower severity.
In conclusion, according to the graphs presented, age and gender does affect your likelihood of developing long COVID. And if you're above the age of 50, male or female, the risk of having post-COVID symptoms does increase. But the older you get, the riskier it becomes. Now, our call to action is that antiviral medication should be reserved for people 50 and above.
Thank you.